Hi, I'm Kenny.
Hi, I'm Alex.
Hi, I'm Michaela.
And I'm Daniel, and our product is an artificial pharynx replacement. So the pharynx is a cavity that connects your mouth and nasal cavity to your esophagus. Its function is to swallow your food and take it from your mouth to the digestive system. In this image, it is the colorful section over here. About 90,000 cases of nasopharyngeal cancer worldwide occur, and this happens in this green region up above behind the nose. The treatment options include radiation therapy, chemotherapy, and surgery. However, surgery is only used when the first two methods don't work. As you can see from this image, the surgery involves slicing open a large portion of the neck, and then an autograft is taken from either the pectoralis muscle or the intestine and used as a replacement. This creates additional surgery sites and creates further complications. Many times the surgery fails, and there's a 5-year survival rate of 38%. As a result, this is only used as a last resort. Therefore, our need is for a pharynx replacement implant that provides prolonged support and function in order to prevent additional surgeries in the future.
For our approach, we will be modifying a polymer scaffold. The polymer we selected is a woven PTFE polymer due to its many advantageous mechanical properties. PTFE is used in many cardiovascular applications and has excellent mechanical properties such as it being excellent in compliance and excellent chemical resistance. Collagen sheet will be applied to the inner and outer layers of the scaffold to provide it with tensile strength, structural integrity, and cellular recognition. A coat of an inflammatory drug, hyaluronic acid, will also be applied to the polymer scaffold to provide it with relief from inflammation after surgery, and a degradable suture will be used to fix the scaffold into the patient's neck.
There are several benefits to using this implant as opposed to the traditional surgery. The biggest one is that there would be no more need for additional donor sites, which are separate surgeries on their own and carry with them their own risks and complications or infections. This would provide a more sustainable integration that can prevent fistula or stricture, which fistula is the gaps between the tissue implant and the native tissue, and stricture was when it swells and closes. Because this implant is a synthetic polymer and is collagen, there are no cells for the tumor to regrow, but with an autograft, there would be the cells that could propagate the tumor growth. This can be custom cut to the different size needed for the patient, and we'd be able to adjust the size and properties to increase the fatigue resistance. And this implant would reduce the need for any additional surgeries after the initial. There are a few limitations to this, being a combination of both a biomaterial and a drug. This would require more FDA approval steps and also cost a lot more money. It's still a high-risk surgery because they are still opening up the neck, but this, again, wouldn't need any additional surgeries anywhere else on the body. There could also be issues with vascularization, as there have been no successful vascularizations of polymers implanted into the body.
So currently there are no existing artificial implants as competition, so it would just be the current pharyngectomy procedure. As we've already talked about a little, the problems with the current procedure include the need for 2 surgical sites because of the autograft, the high rate of failure, and a lot of that is caused by stricture, which can happen to patients after they've received the surgery, having previously received chemotherapy. It's often used as a last resort because of its low rate of success, and there is a risk of tumor regrowth because when you are doing an autograft, you cannot cut away as much of the tissue. So our product compares by hopefully providing surgery to a broader group of people. We're hoping that we can open this up to patients with stage 1 or 2 cancer, or even patients suffering with dysphagia or a non-cancer related problem with their pharynx. And it would also reduce surgical sites, so patients would not have to suffer with the scars from an autograft. And overall, we are just hoping that this will vastly increase the survival rate. Thank you for listening to our presentation.